live stream, this could go incredibly well.
We'll see.
We never really know. Okay, we got it. This never happens. Hey,
All
everybody.
right.
This is Dr. Jennifer Gardella, and I am here with Kim Permar, the executive director of BCHIP, whose last name I'm still getting used to. And we are here on our monthly meeting to talk about BCHIP. Kim, how are you doing today?
I am well, thank you. It is nice to be here today. I'm looking forward to talking about some good stuff going on here at Beechip.
Yeah, so as we all know, the world of healthcare and funding is in flux, shall we say. So Kim and I decided that it was great time to come on and talk about the tried and true things that her and the team are doing to truly impact and improve the health of all of the residents of Bucks County. That's what we decided, right, Kim?
Absolutely, that's what we decided. Yeah, because
So
there are a lot of challenges in healthcare right now. And so I think focusing based on the information that you and I discussed, focusing on the things that we do and the things we do well and the resources that are still available for our community are important for people to know.
yeah, absolutely. So I have to be honest, I don't think you and I have ever talked about this, but I have a real soft side for your smoking cessation program. I think it's an incredible gift almost that you give to the community and the individuals that you serve. So why don't you talk about it?
I'm happy to do that. The smoking cessation program is one of the original programs for BCHIP. We've been receiving funding from the tobacco settlement funds for close to 30 years now to offer this program for Bucks County. And we are very fortunate. We partner with the Southeast Council. They do a lot of work in prevention and education and working with youth to try to prevent smoking and vaping. But BCHIP's lane has been cessation for quite a long time. And we offer all of the smoking cessation classes that are needed sorry, had to quiet the phone, that are needed for our health systems here in Bucks County. We're also able to provide classes for employers should they want to do that. We provided classes at churches, any community group that has requested it. We use an evidence-based program from the American Lung Association, and all of our facilitators are trained in that. And we have 5 sessions. People participate in the classes for 5 sessions. And they're not encouraged to quit until I think week 2 or 3. So for anyone considering it, you're not expected to come to the table ready to quit right away.
Right.
In fact, a lot of people that come through the class don't always quit with the first round of classes. So they get to come again. They can come as many times as they want. And then there are folks who have quit that also come back and take our classes because they share their experiences with others and it helps them to stay quit as well. So it's a really great program. Clients get free nicotine replacement therapy when they participate, so gum or patches or lozenges, and that's all included in the program. The program can be live or it can be virtual. We do both ever since COVID. So some classes are live at the hospitals and things. Other classes are all done virtually. People are mailed all the information that they need. So there's good and bad. We eliminate all those barriers for folks as far as transportation is concerned. Our facilitators have all been doing it for quite a long time and
They
are
have.
really passionate about it. What else can I talk about for that? So any other questions that you have that I can answer about the smoking cessation program?
Yeah, so when's the next session starting?
That's a question that I don't think I have the answer to off the top of my head, but we can always visit our BCHIP website at bchip.org to get that answer.
All the information is there.
Yeah, the classes are starting regularly all the time, so that's why
Okay.
I'm familiar, but they start every 3 to 4 weeks. We have another class that's starting virtually or live.
Great. Yeah, I mean, I love the program because it solves what I believe to be like one of the biggest drivers of health is the ability to stop smoke. Besides, getting obesity under control, it's one of those top pillars of, okay, if you have some bad habits, which we all have bad habits. I've never had the smoking habit, but I do have a strong aversion to it. And now, with vaping, everyone's like, "Oh, I don't smoke, I vape." I'm like, "That's worse."
Mhm.
So, to kill that addiction early on is, I think, really important.
It's
or
so
as soon as
important.
possible.
And I don't think folks recognize nicotine, number one, as a substance that requires treatment and support to quit. People think, oh, you should just quit. And I have to tell you, when I first started my career in public health, I was trained as a smoking cessation facilitator. And as someone who hadn't smoked, I was amazed at the emotionality that goes into it.
Yes.
And I learned so much, one in my training, but two from the participants about how very, very hard it is emotionally, not just physically, but even with their routines and their habits and how much they rely on it. And so having a class setting really does show improved outcomes. We know that people are more likely to quit and stay quit if they participate in an evidence-based program like this because you, one, learn the skills, two, you learn about what you're feeling and that it is part of the addiction. And three, you form these relationships with others. We have some folks that have stayed friends for years and years and years from this class, and they still reach out and support each other so that they can remain a non-smoker. So it's really interesting.
Right, and that's part of it, right? Because I've have read a lot of data that shows that people who quit tend to have to give up a lot of their friends because their friends are smokers. It's the smoker clutch at work, or all their friends on the weekend smoke, or they're at bars where they're smoking outside, whatever it is. And so that support is key. And the other thing that I love, because some of your facilitators have come on and talked to me at times, is look, we're not expecting you to go cold turkey in 5 weeks. So you may have to re-audit the program. You may need to come back. But if you can decrease the amount, even if it's a couple of cigarettes every time you go through the program, that's really significant.
Exactly. Exactly. So yeah, we are very fortunate to have that funding and be able to sustain that program for quite a long time. And we've helped a lot of people. And I love their stories. We usually get a testimonial, at least one or two every year that we use for our annual event. And boy, the support that they have and the kind words they have to say about the facilitators and how much the class meant to them, it really does inspire us to keep doing that program.
Yeah, it's awesome. Okay, so smoking cessation. Let's move on then to your advanced care directives, because that is
Yeah.
a heck of a program.
It is. So that's another one of our free programs. And so for anyone who does not have a living will or does not have what we call a healthcare agent or a power of attorney for healthcare. So again, not a financial will and not a financial power of attorney. We do not do
Right.
those things here. We have references to send you to should you need them, but we do the living will documents and a healthcare agent form. And as being someone who has sadly had several family members who were diagnosed with terminal illness, another one that had a permanent brain injury, I have been the person that had to make these decisions on multiple occasions. And I can tell you, having this document in place meant the world to me as a family member because I don't want that responsibility of knowing what somebody would want when they're in those circumstances and
Right.
having it documented and knowing ahead of time, I know confidently this is what they would want, gave me the strength to be able to make those decisions. And so that is the
Yeah, and
purpose.
I think it's hard to make those decisions as an individual. It's harder to communicate it with your family. And that's something that you guys do really well too. You can facilitate the conversation. So it's, hey, child number one, you're not going to be in charge because child number two is. And
Mhm.
whatever the reasons are can or cannot be discussed, or whoever is going to be that person in charge of making the final decisions.
Yes, our program has two competing priorities. One is that folks fill out the document and we
Right.
get that document in the electronic medical record if the client lets us, because we want the doctors and the healthcare providers to have access to that form when it is needed. So that's the first priority. But the second priority is exactly what you said, and that is having those challenging conversations with family. And it's funny to me because it's one of those things in our family we never wanted to talk about, but nobody lives forever. Sadly, right? No one lives forever. We know this. We know that no one lives forever. And so while it's not fun to think about end of life, it is something that is inevitably going to happen to every single human. So, how do we have these conversations in advance? Because they're a lot easier to have when someone isn't ill than when they are. And if you've waited
Absolutely.
until somebody's ill, you can still do it. It's just sometimes harder emotionally. Not that it can't be done, it just makes it harder. So I'd much rather have these conversations with family when somebody isn't sick and have everybody in the family hear it than when somebody is sick, because then you have that emotionality involved that just makes it harder.
Yeah, really, really good points. And it doesn't have to be an awkward conversation either, or I guess your team can make it less awkward.
We try. That's pretty much the goal of the program. So it's free. There are 9 locations throughout the county. Our website includes that information as well. We've had a lot of success in partnering with our local legislators. So we offer these conversations with our volunteers at Representative Davis's office, Rep Brennan's office, Rep Hogan's office. I know I'm going to forget somebody. I think Representative Shelby Labs. But there are
Okay.
several offices that we offer it throughout the
Oh,
county, in addition to the different hospital locations or doctor locations. But our legislators have been just a huge support for this initiative, and we appreciate their help.
yeah, that's great. Okay, so the third big thing that you guys focus on, I shouldn't even say the third big thing because you do so much, but a big part of your work is around vaccines.
Yeah.
So we're not going to discuss the political ramifications or what is going on in the world around vaccines. What do you offer and what are you giving? And like how people who are stuck but want to get vaccinated, but what can you offer them?
I appreciate that. So, we have to say, I would not be doing my job if I didn't say vaccines do not cause autism. I'm sorry. I need to state that for the record, that vaccines do not cause autism. And so we know that there is lots of research about vaccines and the benefits of being vaccinated. And so we know that there are particularly some folks that are more at risk for respiratory illness and disease. And those folks particularly really want to be vaccinated or should be vaccinated. And the good part is, I can tell you that we have seen very good utilization of folks wanting to take advantage of these services in Bucks County. So we are a partner with our health department. Our health department does a lot of good work around vaccinations as well. And what BCHIP has kind of done is brought vaccines to where people can't get to. Or so in other words, if they can't get to the health department or they can't get to their primary care doctor. So we have multiple programs for that. One is our homebound program. So anyone who's
Right.
homebound, if they need any recommended vaccine, RSV, shingles, pneumonia, flu, any of those vaccines can be brought to the client's home. And we will also vaccinate care members or family members or caretakers, because it's very hard for those people to get out as well. So if you
Sure.
are taking care of a loved one and that person wants a vaccine and we're coming to the house and you want your vaccine, we'll provide that for you as well. And so we have a pharmacy partner that helps us implement that program, but you call us here at BCHIP and we will schedule those appointments for you. The other program that we've done is we partner with several vaccine providers, particularly Giant, in bringing vaccines to where people are, like senior centers, senior living facilities, our senior health fairs that all of our legislators are hosting. We're bringing vaccines to all of them. We did several hundred vaccines just last week with Senator Frank Ferry's team. We have gone to the shelters. We will go to apartment complexes. We will go
Okay.
wherever somebody is requesting for us to bring vaccines on site to provide education and provide any recommended vaccines.
Yeah, and I'm gonna just jump in here and say this. One of the things that you do really well, because we help you do it, is get information out to make really good informed decisions based on solid information and discuss them with a healthcare provider. So
Yeah.
that's another service yes, you did state that vaccines don't cause autism, but you also do give people a lot of resources to find out the information themselves. And then, just like we're all not experts in a lot of things, make sure that you find a good expert that you trust to talk to about how you are, vaccinating your children, or are you getting the flu shot, or are you going to get a COVID shot now? And so that, there's a wealth of information that you guys can provide and say, okay, read all this and then go talk to your doctor.
Exactly. And our pharmacy partners are great at helping to provide that information too. Sometimes the pharmacists know more than the doctors, to be honest, because that's their area of expertise sometimes more than the physicians. Not all, that's I don't want to generalize, but I will tell you very often the pharmacy partners are aware of a lower dose vaccine that maybe the doctor wasn't aware of, or
Right.
different ways to administer the vaccine that are less likely to cause a side effect to somebody with a certain illness. So truly the pharmacy partners tend to be real experts in that, which is excellent.
That's really good to know.
Yeah. And the
Okay.
last the vaccine program I just want to mention too is our immunizations for children. So we have a pharmacy partner that we've identified the school districts that had the lowest rate of immunizations. So they had the most kids that were going to be excluded from school because they had not received the required vaccines.
Ah,
And we came on site. So we partnered with Morrisville, Bristol Township, Bristol Borough, Quakertown, and Ben Salem, I think, is still pending. But we partnered with those districts and brought vaccine clinics to the districts to eliminate all barriers for families and children to be vaccinated so they don't get excluded from school. We even secured some private funding from C&M Bank, which we were so grateful for, and Walmart, so that if families had copays or if they were under or uninsured, we could use those private funds so that all of that is covered and there's no barriers for the kids to get the vaccines that they need. It's been great. It's
that's
been a great
amazing.
program. Yeah, we did over, I think, 160 shots just in the month of August. So we were thrilled for that because those kids would not have been able to go to school.
Wow. Okay. So, smoking cessation, advanced care directives, and vaccine programs, keeping Bucks County healthy and safe in a multitude of ways. The work that you guys do is really incredible.
That's the goal.
And then keep on chugging, Kim, with all the other stuff that you've got a lot of irons in the fire, as they say.
I appreciate that. We can talk about some more of those next time. So thank you for your time today. I appreciate it.
Yeah, absolutely. We'll be back again in a couple weeks. And if you have any questions about anything you've heard, please visit bchip.org for information on how to get in touch with Kim and her staff. Thank you.
Thank you.